Hi, this is Junaid, AINeuroCare Care Stroke and Epilepsy Specialist. Within this particular topic, decide wisely how to choose a medical specialty, work-life balance, and we are talking about how lifestyle considerations are very important for your choice of subspecialty, how moral injury burnout should impact your choice of medical specialty, and more importantly, if you're a woman, what is the difference in terms of lifestyle considerations for you. And it is extremely important, in my opinion, that this should be considered a separate topic, and therefore I'm making sure that you understand the data behind it. Now, first and foremost, are women physicians better? And it's interesting to actually even put that question into context. And the short answer is yes. As a matter of fact, in my personal life, I've personally witnessed that women physicians are much better physicians, believe me or not, than male physicians, even though technically it's a male-dominated field at the moment, but they do perform better. And it's not just my opinion, it's actually backed by data. If you see this particular study, it actually concluded that women physicians end up having better outcomes in terms of mortality and readmissions. So clearly there's a difference that they provide. And one of the things is that they are better at following evidence-based medicines and clinical guidelines. And not only that, that is the key thing. They're very effective communicators. And they're much more effective, unfortunately to say, sometimes with their male counterparts as well. But it's insane to know that women physicians, about 40%, so if there are 10 women, 4 of them within 6 years will go part-time or even leave the field of medicine. And this is not statistics coming from Pakistan or India. This is United States. It is hugely impacted. This is so annoying, so ridiculous to see our high-performing physicians leaving the field within 6 years. Technically, it is the prime of their medical career when they're starting to leave the career itself, or at least putting it on a back hold, including going part-time. And this is a quote that I have to read. I mean, when you invest more than a decade of your life to learn a skill, you're willing to walk away from that early in your career, that's more than a red flag. It's a burning fire. And that's just insane. Women don't only perform better in clinical settings. Interestingly, they actually do much more in terms of what we consider citizenship tasks. Citizenship tasks are those tasks in which physicians are doing their services which are not directly reimbursed. Like I get paid for, let's say, spending time in the neuro ICU. I don't get paid enough to actually go ahead and review medical charts for other physicians, do quality control work, etc., etc. These are considered citizenship tasks. And especially in academic medicine, the citizenship tasks that are performed by women are at an increasingly more rate, and they're expected to do more, and that is just unfortunate. I want to point out this other culture in medicine itself that is expected out of physicians that is not in any other field. And I know this because I do head a digital sort of health company. And if I were to ask a software engineer to do work extra hour for unpaid, that would never go well. But in medicine, it's just an expectation to do these citizenship tasks for free. And unfortunately, the bearer of the burden is more so on women physicians because, to be honest, they're better at it. They're better at managing people in most situations and better at organizing things in terms of their abilities. And therefore, they end up doing more uncompensated work as compared to men. COVID-19 has been also a major impact on women in healthcare, both nursing and physician. As a matter of fact, they eventually left workforce more so because clearly once the shutdown happened, you could see that they have more responsibilities at home and they had to take care as the childcare services were closed. As a matter of fact, if you can look at it, women lost more jobs and they are not recovering from it. And that's a significant issue. And to be honest, it's sad because, as I said before, that we definitely need women, especially at a level of physicians, but more importantly, even in nursing levels, women are not coming back to work at least full time. And it is not just the nursing and physician, by the way. They have lost job in every sector. If they're respiratory therapists, if they're pharmacists, in every sector of healthcare, women have lost more healthcare job as compared to men. Again, you make sure that you go to Academy website for regular updates. I just updated another gender gap in compensation and anesthesiology study on my academy.AINeuroCare website. Thank you. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.